Hello, welcome back to the last episode of season 3 of the Dr. Ramsey Show. Even though we aren't going to have any more shows this summer, we'll start up again in the fall, you will be getting a weekly newsletter. And in the newsletter, you'll be made aware of things that are coming up, like Dr. Lofton, nurse practitioner, and Dr. Colpart, nurse practitioner, are both going to be helping me do education nights on hormone replacement therapy. Both of them, as you know, you've met them, are excited about what they're learning from my teacher. They go back in September to learn more. So we'll be offering those free. We're either going to do them here at the clinic or on a webinar. So look out for those if you're interested, or you want your friends to listen to some of the research and what we have to say. I want to read this. This is from one of our people who received the newsletter that's not a patient, that just had a general question. But it's personal, but to me it's also general. She says, I've been reading up on bioidenticals and have a question for Dr. Ramsey. Perhaps she could address this one in her upcoming videos. I'm a 72-year-old woman, nearly 20 years post-menopause, and have never been on hormones. Dr. Ramsey's videos have sparked an interest in them for me. I have read from more than one source that if one is to begin taking hormones, it should be done within the first 3 to 5 years of starting menopause. She says, otherwise, taking them provides little to no benefits. Of course, I have little arthritis some days, mild osteopenia, and normal, what you would expect as a 72-year-old woman. I do not want to rock the boat at this stage in my life or increase the risk of breast cancer. Is it too late to begin hormone replacement therapy? And if not, what type of benefits would be gained? ? If I were your mother, what would you advise? That's cute. Thank you so much for your question. So what you're saying about starting hormones within 3 to 5 years of menopause has everything to do with synthetic hormones and nothing to do with bioidentical. That came out of the WHI study. If you want to go back in our videos, we've reviewed the WHI study. I met my teacher before then, which was so interesting watching it unfold, but that was synthetic. Bioidentical hormones, you can literally start at any age. And what you would expect is to feel and function better. What I mean by that is you say you have some osteopenia, so it makes your bones strong. There is no risk in taking hormones. And number one, it reduces the risk of breast cancer when women take hormones in menopause compared to women who don't take them. In every single double-blind placebo-controlled study to date, women who take estrogen in any form, even Premarin, I only prescribe bioidentical, have lower risks of breast cancer than other women. So I learned this from my teacher last time. I had not heard him say this before, but it makes a lot of logical sense to me. He says, within the breast cell, if there's no estrogen stimulating it to tell the cell what to do, it directs the cells on how to perform optimally, then cortisol increases. We've got insulin resistant at the breast tissue. We have an increased risk of breast cancer simply because estrogen is not there, preventing it. So it will not increase your risk of breast cancer. It can improve your bone strength. And I think you said some aches and pains. Hormones do help with aches and pains too, because as we age, that tissue becomes stagnant. Without the hormones, it just can't move. So it's very safe, no risks. And I hope I answered your question. If not, right again. So the hormone education nights we're going to talk about in the upcoming newsletters, but I have 2 more questions. What is the difference between viral and bacterial infections? We went over last week what we do to treat them. And if your clinic treats them naturally, why doesn't my doctor? That's an interesting question because, our body can get over its own infection if we are healthy enough, right? And rest, etc. We don't always need to take medications. A lot of doctors have not been trained in IV therapy, where we give vitamin C, which converts to peroxide, and no bacteria, virus, or parasite can live in that environment. We're creating an environment that the bacteria, virus, or parasite cannot live anymore. And that's with high dose vitamin C. Yes, the B vitamins help and the zinc, all of those things help, but the high dose C is what's going to kill both bacterial and viral infections. It may take, yes, more than one always. I shouldn't say always, sometimes it doesn't, but most of the time it takes more than one. In fact, before we had COVID, this was in 19, I believe, November, I was so sick. There were cells on my blood work that said that it looked like I was septic. And one of my nurses wanted me to go to the hospital, which I would never do because I know my body can handle it. And within a matter of days, I was fine. We didn't know about COVID then, but I think that that's what it was because it was the hardest thing I ever got over with the IVs. Another person wrote and said, how does your clinic treat infections naturally? Well, I just explained that. And what I want to explain is the difference between viruses and bacteria, right? So we have all these antibiotics to treat bacterial infections. Bacteria are single-celled organisms. They can live on a surface for up to 2 weeks, depending on that bacteria. So if you touch a bacteria that someone sneezed on, we can actually get sick, even if we didn't know it was there. Viruses, and they're on the outside of the cell when we get infected, and it's in one area, like pneumonia, sinus infection, and there's lots of antibiotics designed to treat them, but we don't have to use them. We can use the vitamin C as well. Viruses are different. There's not many antiviral medications. There's one, valacyclovir or acyclovir. It works very well at treating, herpes 1, herpes 2. That's it. We don't have no other antiviral medications except for vitamin C. Why? Viruses cannot live on their own. They do not live on surfaces. They need a host, and they go into our cells and live off of our cytoplasm, what's going on in our cytoplasm. They need our energy, and they go everywhere in our body. That's where we have the aches and the pains, and it's systemic. That's viral. Bacterial is localized in one area, and there's not many antivirals, but the vitamin C's work wonderfully for them. There's other things for the immune system, like whole immune. That's our 5-in-1 immune support that we all take, because if we get sick or run down, we pop it up pretty high, and that works as our antibiotic. That's called orthoimmune. I think I said whole immune. That's a beta glucan. That's a 1-a-day immune support that boosts your immune system if you chronically are getting ill. If you're not chronically getting ill, you don't need whole immune. So I think that answers everything. And then you're going to hear from us weekly now from our weekly newsletters, and we'll keep you updated until we are back in the fall. Thank you so much for listening, and have a blessed day.